Hi guys, John Adamson, the Rehab and Documentation Guru. Just doing a video on maintenance therapy, a little bit different take than previous. And this is in response to a question that got asked on a geriatric Facebook group regarding maintenance therapy. The clinician reports that she is aware of the regulations but wants to know things like, do you need to discharge the patient from rehabilitative care and then start them on maintenance therapy? Do you still need to do the OASIS under maintenance therapy? And just basic questions of, how would you transition? So, first and foremost, no regulations change regarding the conditions of participation for home health, whether you've got a maintenance patient or you've got a restorative patient or rehabilitative patient. So, you have to complete the regular assessments, including the OASIS. The question of whether you would discharge the patient or not, well, no, you don't need to. What you would do, though, is you would get an order from the doctor for maintenance therapy, and it would be obviously advisable to do a reassessment. Now, the question might be, well, would you need to do a significant change assessment, OASIS assessment? And that depends on you and the patient. Now, the significant change is meant for the fact that the patient has had a significant change. But when you're getting a patient on maintenance therapy from restorative therapy, we're likely not looking at a significant change. So a simple reassessment should be sufficient. Of course, we have our 30-day reassessments, but you can always do a reassessment early. That's fine. It can't be done late, but it can be done early. And then, of course, you're starting your new 30-day window. So I would do a reassessment with an update to the plan of care with orders. Now, the orders will need to include the new goals. The doctor has to sign off on any new long-term goals, and in a maintenance situation, you would be putting the patient as having new goals that the doctor would need to approve. Obviously, your frequency would be impacted, and potentially your duration. Just because somebody goes on maintenance therapy doesn't mean they go on forever. The question always has to go back to medical necessity. Is the care that I'm providing so complex that only a skilled licensed therapist can safely and effectively do the care? That includes restorative therapy, that also includes maintenance therapy. So you need to be able to answer that with your own daily documentation of your visits. The coding of the visit, depending on what EMR you use, may be a little bit different. There is a maintenance treatment or visit code, and that's something your office should be able to apply. But those would be the steps that I would do. No, you don't need to discharge. Yes, you should reassess. Your goals will be updated and need to be approved by the doctor with a specific order stating maintenance therapy. Anyway, I hope this brief video helps. Hope you're having a great day. Take care and God bless.